Hi, my name is Grant Murphy. I'm a senior at Los Gatos High School. In this presentation, I will go into detail about an emerging branch of cancer immunotherapy, oncolytic virotherapy. Oncolytic virotherapy shows much potential as a cancer therapeutic, but it requires more research to develop this therapy into a viable treatment option for various cancers. What is an oncolytic virus? Oncolytic virotherapy is a branch of immunotherapy that relies on the use of a virus that has been engineered to be, or naturally is, selective towards cancer cells. These viruses, called oncolytic viruses, are able to infect, replicate in, and kill cancer cells while sparing the non-cancerous human cells. Additionally, oncolytic virus infection is thought to stimulate an anti-tumor immune response. Focus. The oncolytic viruses we will focus on in this talk are measles viruses, H1 parvoviruses, reoviruses, and the Newcastle disease virus, or NDV. These viruses have significant but limited research on them, and they are naturally oncoselective and generally resemble their natural state with limited genome modifications, making them classified as wild-type oncolytic viruses. Tumor-specific tropism. Since oncolytic viruses are live viruses, they carry an inherent danger for their ability to infect and kill non-cancerous cells. Oncolytic viruses, such as H1 parvovirus and Newcastle disease virus, have a natural preference for tumor cells. This oncolytic preference of H1 parvovirus cannot be traced to one single factor, but rather to many different factors throughout the life cycle of H1 parvovirus. Unfortunately, not all these oncoselective factors are specific to malignant cells and instead can be attributed to proliferating cells more generally. Since not all tumor cells are rapidly proliferating and non-cancerous cells can be proliferating, H1 parvovirus infection could result in some undesirable outcomes. Reovirus is a human pathogen that has very mild human infections, but it preferentially replicates and lyses in transformed cells because of factors which include epidermal growth factor, which stimulates RAS signaling pathways. While reovirus benefits from RAS mutations, reovirus can be effective in RAS-independent cancers, but so far no factors determining reovirus efficacy in non-RAS tumor cells have been elucidated. Oncolytic measles viruses are derived from laboratory strains of measles viruses, which have been mutated to experience cell entry tropism from the CD46 protein, an overexpressed transmembrane protein on tumors, in order for the measles virus to be oncoselective. Clinical efficacy. Oncolytic viruses show promise in vitro transformed cell lines and in improving overall survival, but there is still a long way to go in terms of efficacy for oncolytic viruses as a monotherapy. Several clinical trials have been conducted regarding the efficacy of various oncolytic viruses. One trial used H1 parvovirus to treat progressive, primary, or recurrent glioblastoma. They found a median overall survival of 15 months, which is greater than the expected overall survival of recurrent glioblastoma in 9 months. While this demonstrates some potential for H1 parvovirus in regards to efficacy, no progression-free survival lasted more than 6 months. Thus, this therapy still has much to improve in its efficacy. A clinical trial studying the use of reolizine, a reovirus therapy, in 12 patients with multiple myeloma found no objective response in patients treated with reolizine. The author of the trial proposed 3 different factors that might have contributed to an inadequate clinical response. 1. Unable to overcome inherent viral resistance to cytolysis. 2. A lack of an oncolytic virus-related anti-tumor immune response. Or 3. Inaccurate dosing. Oncolytic virus-induced immune stimulation. The presence of tumor-infiltrating cells, such as cytotoxic T cells and natural killer cells, are correlated with a better prognosis in tumors. Tumor microenvironments that contain numerous infiltrating immune or T cells are inflamed or hot. Oncolytic viruses contain the ability to change uninflamed or cold tumors to hot tumors. Upon tumor cell lysis, oncolytic viruses cause the release of molecules with pathogen-associated molecular patterns, abbreviated as PAMPs, and damage-associated molecular patterns, abbreviated as DAMPs, which cause an inflammatory effect and activate immune response when recognized by pattern recognition receptors, which is abbreviated as PRRs. When stimulated by pathogen-associated molecular patterns and damage-associated molecular patterns, the dendritic cell releases inflammatory and antiviral cytokines, type 1 interferons, which lead to cytotoxic T cell activation. Oncolytic virus-induced disruption in tumor perfusion. Solid tumors need a constant blood supply in order to proliferate and to metastasize. To achieve this blood supply, tumor vascularization and angiogenesis are promoted by vascular endothelial growth factor. In preclinical in vivo models, oncolytic virus treatment to tumors with baseline high vascular and endothelial growth factor levels showed significant ability to disrupt tumor vasculature and infect tumor-associated vascular endothelial cells. There was a 90% decrease in perfusion recorded throughout these tumors, while adjacent normal cells showed no change in perfusion. Disrupting tumor perfusion is often followed by durable tumor necrosis. What is combination therapy? One promising approach to improving the efficacy of oncolytic virotherapy is combining oncolytic viruses to synergize with another cancer treatment called combination therapy. There are a wide range of promising combinations involving oncolytic virotherapy, including combining it with immune checkpoint inhibitors or chemotherapy. Immune checkpoint inhibitors plus oncolytic viruses. The overexpression of immune regulatory receptors can create an immunosuppressive state in the tumor microenvironment. Immune checkpoint inhibitors bind to these receptors, preventing their immunosuppressive function in the tumor microenvironment. Immune checkpoint inhibitor response is dependent on T cell infiltration due to their direct effect in preventing immune regulatory receptors from being activated on T cells. Oncolytic viruses have a natural ability to increase immune infiltration because they stimulate antigen-presenting cells through the release of pathogen-associated molecular patterns. In turn, these antigen-presenting cells then activate T cells, allowing for anti-tumor immune response. Thus, oncolytic virotherapy has the ability to improve immune checkpoint inhibitor-based cancer treatment. Chemotherapy plus oncolytic viruses. A promising combination that is being explored is combining oncolytic virotherapy with chemotherapy. The combination of oncolytic viruses and chemotherapy demonstrate promise in non-small cell lung cancer lines for their ability to improve oncolytic virus-induced cell death through synergy with chemotherapeutics. Additionally, this combination has the potential to lessen the dose and duration of the chemotherapy treatment, consequently decreasing side effects and the chance of drug resistance. Conclusion and future perspectives. The field of oncolytic virotherapy has exponentially progressed since its advent at the beginning of the 20th century. Unfortunately, as far as this field has come, there is still major progress needed in this field. Many of the details regarding oncolytic viruses' oncoselectivity are not fully understood or accounted for, and some oncolytic viruses have struggled with clinical efficacy. Not without challenges, Oncolytic viruses show great potential as a therapy for cancer, whether on their own or in combination with another therapy. Between all of the wild-type oncolytic viruses mentioned, only one phase 3 trial has been completed. More phase 3 trials and research must be conducted to advance these wild-type oncolytic viruses as oncolytic agents. From 2000 to 2020, 97 clinical trials have been published on oncolytic viruses, with many more planned for the future. Demonstrating the potency of oncolytic viruses field. Future studies will undoubtedly try to address the challenges of wild-type oncolytic viruses discussed and bring them to the forefront of cancer therapy. Thank you for listening to my presentation.